Most of us grew up hearing, eat your veggies, they're good for you. And yes, they are, but that's not the whole story. Once you hit 60, your body starts to process foods differently. According to data from the CDC and several clinical nutrition journals, certain vegetables, even the ones we think are superfoods like spinach, carrots, or romaine lettuce, can interact with medications, thin your blood too much, or spike your blood pressure overnight. The scary part? You won't feel it coming. No pain, no warnings, just a normal evening, followed by slurred speech or loss of balance the next morning. In today's video, we'll reveal 6 common vegetables that older adults should be very cautious with and how to make safer, smarter choices at every meal. Before we dive in, don't forget to like, share, and subscribe to Elderly Health Tips. Let's keep you informed and safe. The number 1 vegetable you should pay attention to: spinach. Spinach is rich in oxalates, naturally occurring compounds that bind to calcium in your digestive tract and bloodstream. In younger bodies, these complexes are usually excreted. But in older adults, reduced kidney function and slower metabolism can cause these oxalate calcium crystals to circulate longer, eventually depositing in blood vessels, including those in the brain. A 2018 study published in the Journal of the American Heart Association showed that high oxalate intake was significantly associated with increased vascular calcification, especially in people over age 60. These calcified vessels become less flexible, disrupting normal blood flow to the brain, a direct contributor to ischemic stroke and vascular dementia. Even more alarming, the National Kidney Foundation warns that oxalate overload, especially in individuals with reduced kidney function, which affects roughly 38% of people over 65 in the US, according to the CDC, can lead to crystal buildup in small arteries, not just kidney stones. Now let's talk numbers. A 1-cup serving of cooked spinach contains 750 milligrams of oxalates, one of the highest among common vegetables. The safe upper limit of oxalate intake, according to Harvard Health, is roughly 100 to 200 milligrams per day for individuals at risk of kidney or vascular complications. That means just 1 serving of spinach can exceed your safe range by 3 to 7 times. A 2021 NIH study found that adults over 65 who consumed high oxalate diets were 28% more likely to show early signs of arterial stiffening compared to those on low oxalate diets. And here's the kicker: timing matters. Eating spinach at night, when your digestion slows and your kidneys are less active, gives your body fewer chances to clear oxalates effectively. Combine that with evening vitamin D or calcium, and you've created the perfect storm for calcium oxalate buildup, potentially affecting microvessels in the brain, heart, and kidneys. So, what should we do? Let me be clear. I'm not saying spinach is bad. It's still packed with iron, folate, magnesium, and fiber nutrients that are incredibly beneficial, especially as we age. But just like any medicine, the dose, timing, and how we take it matters more than we think. For many of my patients over 55, I always remind them, small changes can make a big difference when it comes to how our body handles high oxalate foods like spinach. Boil your spinach and throw out the cooking water. Research from the USDA shows this can cut oxalate content by up to 40%. It's a simple trick that makes spinach a whole lot gentler on aging kidneys and blood vessels. Skip the spinach at dinner. Instead, try eating it at lunch, when your digestive system is more active and your calcium or vitamin D supplements, often taken in the evening, won't clash with the oxalates. Mix up your greens. Don't rely on spinach every day. Rotate in lower oxalate leafy greens like kale, arugula, romaine lettuce, or even amaranth greens. This gives you variety and reduces the chance of building up oxalate crystals in your body over time. Next is the second vegetable. I recommend you think twice before eating: broccoli. Broccoli is a nutritional powerhouse, no doubt. It's packed with fiber, antioxidants, and immune-boosting compounds, but it's also one of the richest sources of vitamin K1. According to USDA Food Data Central, just 1 cup of cooked broccoli contains over 220 micrograms of vitamin K1, which is more than 180% of the recommended daily intake for adults. Now, here's the danger. Vitamin K plays a critical role in helping your blood clot, but if you're on anticoagulants like warfarin, aspirin, or clopidogrel, your medication is designed to slow down that clotting. When you suddenly introduce too much vitamin K, it can cancel out the effect of the drug. Worse still, if your vitamin K intake isn't consistent, say you eat a big plate of broccoli on Monday but none for the rest of the week, your blood levels become unstable. And in older adults, the consequences can be severe. A 2019 study published in the Journal of the American Medical Association, JAMA, found that nearly 1 in 5 emergency hospitalizations for medication-related bleeding in seniors was due to interactions between blood thinners and vitamin K-rich foods. Another study in thrombosis research, 2020, tracked over 600 older adults on warfarin for 18 months. Those with variable vitamin K intake were 2.4 times more likely to experience either major bleeding events or INR instability compared to those with consistent intake, even if both groups ate the same amount of vitamin K. Overall, according to the CDC, over 5 million Americans over 65 are currently prescribed blood thinners, and many of them are not properly counseled on how food, especially leafy greens like broccoli, can interfere. And that's not even factoring in supplements. Many seniors are also taking multivitamins or calcium with vitamin K, further complicating their body's balance. When vitamin K and anticoagulants clash, the result can be dangerous in two opposite directions. If your medication becomes too weak, you're at risk of blood clots, mini strokes, TIAs, or pulmonary embolism. If your medication becomes too strong, you're at risk of brain bleeds, internal bleeding, or massive bruising, even from minor bumps. The brain is especially vulnerable. A 2021 NIH-funded meta-analysis linked vitamin K fluctuation in warfarin users with a 31% increase in intracranial hemorrhage, brain bleeding, particularly in patients over 70 with pre-existing hypertension. I'm not telling anyone to quit broccoli. It's still a powerhouse of nutrients, packed with fiber, folate, and cancer-fighting compounds. But we do need to understand how it interacts with our meds and adjust our diet thoughtfully. Especially for older adults on blood thinners like warfarin, what you eat and how consistently you eat, it can make a real difference. Take my patient Marlene, for example. She's 72, sharp as a tack, and loves her broccoli. But when her INR levels suddenly dropped, we traced it back to a change in her routines. She'd gone from eating broccoli 3 times a week to skipping it entirely for 2 weeks. That kind of inconsistency can mess with how your blood thinners work. Here are the tips I usually give patients like Marlene. Stick to a routine. If you usually eat a cup of broccoli 3 times a week, keep it steady. Don't load up 1 week and skip the next. Always let your doctor know if you're making any big changes to your diet, even with veggies. Leafy greens and cruciferous vegetables can affect how your meds are absorbed or processed. Monitor your INR more closely if you're adding or cutting back on vitamin K-rich veggies like broccoli. Sudden shifts can throw your levels off. Rotate your veggies. Mix in low vitamin K options like cauliflower, green beans, zucchini, or bell peppers. You still get the fiber and nutrients without the vitamin K spikes. Stay hydrated and limit alcohol. Dehydration and alcohol can both interfere with how your liver processes medications, and that's on top of what your veggies are already doing. In short, it's not just about what you eat, but how steady and balanced your habits are. Your plate is like your medication schedule light. Works best when it's consistent. And when in doubt, bring it up at your next checkup. That 5-minute conversation could save you a lot of trouble later on. The third vegetable on the list, raw carrots. Here's the science. Carrots are known for being low in calories, but raw carrots contain simple carbohydrates, including sucrose, glucose, and fructose, which can be rapidly absorbed when eaten alone. According to Harvard Medical School's glycemic index database, raw carrots have a glycemic index, GI, of around 71 when consumed on their own, placing them in the moderate to high category. That means they raise blood sugar relatively quickly, especially in older adults whose insulin sensitivity is already reduced. What's more concerning is the glycemic load, GL, a measure of how much a food raises blood sugar based on a standard portion. A 1-cup serving of raw carrots has a glycemic load of about 10, which is considered moderate but becomes more impactful if eaten at night when metabolism slows. So why does this matter? In seniors, a rapid rise in blood sugar from raw carrots, especially when not paired with fat or protein, is often followed by a rebound crash in the middle of the night. The body, sensing the drop, releases counter-regulatory hormones like adrenaline and cortisol, which can elevate blood pressure suddenly, increase heart rate, constrict blood vessels, particularly in the brain. This phenomenon has been closely studied. A 2021 NIH-funded study published in Diabetes and Vascular Disease Research linked nocturnal hypoglycemia to a 32% increased risk of ischemic stroke in seniors, especially those with a history of vascular stiffness or type 2 diabetes. And most people don't even know it's happening. Symptoms are subtle: night sweats, heart palpitations, morning brain fog, or feeling unusually tired or irritable when waking up. But over time, these swings strain the cardiovascular and nervous systems, wearing down resilience and increasing stroke risk. I never tell patients to stop eating carrots. They're rich in vitamin A, beta-carotene, fiber, and antioxidants. But how and when you eat them matters, especially as you age. Here's what I advise. Don't eat raw carrots alone, especially at night. Always pair them with a healthy fat, like hummus or nuts, or protein, like boiled egg or Greek yogurt. This slows glucose absorption. Eat carrots earlier in the day. Avoid snacking on high GI foods 2-3 hours before bed. Lightly steam or roast your carrots. This alters the starch and slightly lowers the glycemic impact. Track your symptoms. If you wake up with cold sweats, heart racing, or mental fog, jot it down. Try adjusting your evening snack and see if it improves. Consider wearing a continuous glucose monitor, CGM, for a few days. Newer models are affordable and painless, and they reveal blood sugar swings in real time. Next, let's take a look at the fourth vegetable, romaine lettuce. Romaine lettuce might seem harmless. It's crisp, refreshing, and made up of about 95% water. It's also packed with potassium, magnesium, and vitamin C, all of which support heart health, muscle function, and the immune system. But here's what most people don't realize. Because of its high water and potassium content, romaine has a mild, natural diuretic effect. That means it gently encourages your body to flush out both sodium and fluids through urine. According to the National Institutes of Health, NIH, potassium-rich vegetables like romaine can increase natriuresis, the process by which your body excretes sodium, and with it, water. This can be beneficial for people with high blood pressure since it helps reduce fluid retention and lowers overall blood volume. But timing matters. If you eat a big romaine-based salad at dinner or late at night without rehydrating properly, you could set yourself up for mild overnight dehydration. And that's when things get risky, especially for older adults. Here's why. When the body becomes even slightly dehydrated, the volume of plasmath watery part of your blood shrinks. What's left behind? Thicker, more concentrated blood. In folks with pre-existing conditions like hypertension, atherosclerosis, or atrial fibrillation, that thicker blood becomes a breeding ground for clots. And if a clot travels to the brain bam, you've got a stroke. A 2019 study published in Stroke, the Journal of the American Heart Association, found that mild overnight dehydration was a contributing factor in nearly 20% of early morning strokes. Just a 2% drop in total body water was enough to significantly increase blood viscosity in older adults. And here's the kicker. Harvard Medical School reports that the average adult loses about 1.5 to 2 liters of water every night, just through breathing and natural elimination. So if your dinner includes a water-rich, potassium-heavy salad like romaine and you don't drink enough water afterward, you're going to bed with a diuretic effect still active, without the fluid to balance it out. The danger isn't immediate. It creeps in slowly and silently. You might just wake up feeling sluggish or lightheaded. But for some, it could mean waking up in the ER. Why do so many strokes happen in the early morning? The American Stroke Association explains that between 4 a.m. and 8 a.m., the body naturally releases more stress hormones like cortisol, raises blood pressure, and constricts blood vessels. If your blood is also thicker due to mild dehydration, that's a dangerous mix. A 2022 meta-analysis in the journal Neurology concluded that morning strokes are 28% more severe and carry higher rates of long-term disability. And seniors are at particular risk because of age-related vascular changes and reduced thirst perception, which makes them less likely to hydrate properly. Now imagine layering on a large romaine salad at 8 p.m., followed by minimal fluid intake, a long night of fluid loss, and you start to see why Carl was waking up with symptoms his blood work couldn't explain. Again, I'm not telling you to ditch romaine. It's still one of the most nutrient-dense greens. But for seniors and middle-aged adults preparing for healthy aging, timing and hydration matter. Here's what I tell my patients now. Eat your romaine during lunch or early dinner. Avoid large portions late in the evening. Hydrate with at least 8-10 ounces of water an hour before bed, especially if you've eaten the salad that evening. Add a pinch of sea salt or electrolyte powder to your evening water if you tend to urinate frequently. This helps retain fluid longer. Mix up your greens, butter lettuce, red leaf, and baby spinach tend to have lower diuretic effects. Monitor symptoms such as dry mouth, leg cramps, or waking up foggy. These are signs your overnight hydration may be off. The fifth vegetable I want to remind you to watch out for: garlic. Garlic has long been praised for its heart-healthy benefits, and for good reason. It's rich in allicin, a sulfur-based compound that helps lower blood pressure, reduce cholesterol, ease arterial stiffness, and even prevent blood clots by inhibiting platelet aggregation. In fact, a 2016 meta-analysis published in the Journal of Nutrition found that concentrated garlic extract could reduce platelet clumping almost as effectively as low-dose aspirin, especially when taken raw or in high-potency supplements. That's great news for many folks trying to stay off heavy pharmaceuticals. But here's where it gets tricky, especially for older adults who are already on blood thinners. If you're taking medications like warfarin, aspirin, clopidogrel, Plavix, apixaban, Eliquis, dabigatran, Pradaxa, then adding garlic, particularly in raw form or supplement form, can amplify the blood thinning effect far more than expected. And while that might sound helpful, the downside is serious. A much higher risk of internal bleeding, including bruising, nosebleeds, and in severe cases, gastrointestinal or even brain hemorrhages. Older adults are especially vulnerable because their blood vessels are more fragile with age, and even a minor bump or fall can turn dangerous if the blood doesn't clot properly. A study conducted at Cedars-Sinai Medical Center, 2020, found that patients aged 65 and older who combined garlic supplements with warfarin had a 1.8x increased risk of spontaneous bleeding compared to controls, particularly gastrointestinal bleeds and intracranial hemorrhages. The National Center for Complementary and Integrative Health, NCCIH, part of the NIH, includes garlic in its list of herbs that increase bleeding risk, particularly when combined with anticoagulants. Their warning emphasizes caution in patients scheduled for surgery, but the risk applies equally to daily life when mixed with blood thinners. A 2021 review in Drugs and Aging showed that 17% of reported adverse events in older adults taking anticoagulants were due to interactions with herbal or dietary supplements, with garlic ranking in the top 3, along with ginkgo, biloba, and fish oil. And here's a lesser-known fact. Garlic's effects aren't always consistent. The concentration of allicin depends on whether garlic is raw or cooked. Raw equals stronger. How it's processed, crushed, chopped, or aged. The form used: capsule, powder, oil extract. This variability makes it difficult for doctors to accurately dose or predict the bleeding risk, especially when patients don't report their garlic intake. Now, don't get me wrong, I'm not against garlic. In fact, I really like it when it's used the right way. Garlic has its place, but like any powerful natural compound, it needs to be handled with care, especially if you're already taking medications that affect blood clotting. Here are a few practical tips I usually share with my patients to help them enjoy garlic safely. Skip the raw garlic and garlic supplements if you're on blood thinners, especially drugs like warfarin, aspirin, Plavix, or Eliquis. These combinations can quietly tip the balance and lead to serious bleeding risks. Let your doctor know if you're taking garlic in any form powder, oil capsules, aged extract, or even heavily seasoned meals. It's not just about prescription meds anymore. Supplements and diet matter just as much in how your body reacts. Be consistent. If you've been eating garlic regularly for a long time without issues, don't suddenly double your intake just because it boosts the immune system. Big jumps in dosage are where people get into trouble. Use garlic as a flavor, not a treatment. Cooking garlic reduces its allicin content, the blood thinning compound, making it a safer, more manageable option for everyday use in your meals. Watch for subtle signs of bleeding, especially things like unexplained bruises, bleeding gums, pink urine, or black terry stools. These could be signs your blood is thinning too much, and it's worth checking in with your doctor if you notice any of them. Bottom line, garlic is like wine that can be heart healthy in moderation, but dangerous when overdone or mixed with the wrong things. I always tell my patients, the key isn't to avoid it altogether, but to respect it. And if you're ever unsure, a quick call to your doctor is always better than a late night trip to the ER. The final vegetable for today, asparagus. That healthy serving of asparagus with your dinner, if you're over 60 and eating it late, it might be silently thickening your blood overnight. Let's talk about something most people, even doctors, overlook. Asparagus as a mild natural diuretic, and how that plays into your hydration and stroke risk while you sleep. One of my patients, Mr. Harold, 69 years old from Arizona, ate asparagus almost every night for dinner. He loved it steamed with olive oil and a pinch of sea salt. He wasn't on any diuretics, didn't drink alcohol, and exercised daily. But he kept waking up around 4 a.m., dizzy, with a dry mouth, leg cramps, and once even slurred speech. A few tests later, we realized he had slight dehydration and elevated blood viscosity. His blood had become more concentrated during the night. Asparagus contains a high amount of asparagine, a non-essential amino acid that acts as a natural diuretic, helping flush sodium and excess fluids from the body through urine. That's part of why asparagus has been recommended for people with mild water retention or bloating. But diuretics, natural or pharmaceutical, don't choose when to act. If you consume asparagus in the evening, the increased urinary output it triggers can lead to mild overnight fluid loss. According to the National Institutes of Health, NIH, the average adult loses approximately 1.5 to 2 liters of fluid overnight just from breathing and minimal perspiration. If you add in increased urination from foods like asparagus and don't rehydrate properly before bed, your body may enter a state of low-grade dehydration by morning. When the body is mildly dehydrated, your plasma volume, the watery portion of your blood, decreases. This causes your blood to become more concentrated, or what doctors call hemoconcentrated. For younger adults, the body can usually compensate. But in seniors, especially those with arterial plaque, hypertension, or atrial fibrillation, this increase in blood viscosity can lead to sluggish circulation and a higher risk of clot formation. A 2022 study in stroke, published by the American Heart Association, showed that stroke events were 22% more likely to occur between 4 a.m. and 8 a.m., especially in older adults who went to bed mildly dehydrated. Another study from Neurology, 2020, found that overnight hemoconcentration is a contributing factor in up to 1 in 5 ischemic strokes among people over 65. 80% of Americans over age 65 take at least one medication that affects hydration or blood pressure. Source CDC. 48% of seniors report they rarely feel thirsty due to age-related changes in the thirst response. Source NIH. A 2021 observational trial from the American Journal of Clinical Nutrition found that older adults who were just 1-2% dehydrated overnight had 23-29% higher blood viscosity in early morning lab tests, increasing their clotting risk. And while asparagus might not cause severe dehydration on its own, when combined with other diuretic foods like celery, cucumbers, or diuretic medications, it can push your system over the edge, especially if eaten close to bedtime. Asparagus is still a super healthy food. It's rich in vitamins A, C, K, folate, and fiber, and supports digestion and immune health. But here's how I coach my patients to get the benefits without the risk. Eat asparagus earlier in the day, ideally with lunch or before 6 p.m. This gives your kidneys time to process fluids well before bedtime. Drink water after eating asparagus around 8-12 ounces, 240-350 milliliters, especially if eaten in the evening. Pair it with foods that help retain hydration, like sweet potatoes, bananas, or a little bit of sea salt. Track symptoms like cramps or early waking and connect them with what you ate the night before. If you're on diuretics or blood pressure meds, talk to your doctor about how natural diuretic foods might be interacting. So, what's the takeaway here? These 6 vegetables, spinach, broccoli, carrots, romaine, garlic, and asparagus, are often seen as the gold standard of healthy eating, and they can be. But for older adults, especially those on medication or with chronic conditions, even good foods can carry hidden risks. Timing, preparation, combinations, they all matter more than we think. Your body in your 60s and 70s doesn't process things the way it did at 30. That's why it's time to stop treating health advice like one size fits all. Start reading labels, ask your doctor, keep a food journal, hydrate intentionally, and above all, listen to your body. If this helped you see things in a new light, or made you rethink your dinner plate just a little, then please like, share, and subscribe to Elderly Health Tips.